Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, I've reviewed your medical history, and it seems you've recently been experiencing some discomfort in your breast area. Can you tell me more about that?
Yes, it started about a week ago. I noticed that my left breast was quite swollen and it felt tender to the touch. Initially, I thought it might be related to my menstrual cycle, but the pain intensified over the days, and now it feels like a burning sensation, especially when I breastfeed my 2-month-old son.
That sounds concerning. Have you noticed any redness or warmth in the affected area?
Yes, there's a reddish-pink patch on the upper part of my breast, and it feels warmer than the rest of my skin. There's also this lump that I can feel, and it's quite painful when I touch it.
I see. And have you experienced any flu-like symptoms, chills, fever, or fatigue perhaps?
Actually, yes. I've had a mild fever for the past 2 days, and I feel more tired than usual, which I initially attributed to the sleepless nights with the baby, but now I'm not so sure.
It's essential to differentiate between general fatigue due to new motherhood and fatigue due to a possible infection. Regarding breastfeeding, have you noticed any changes in your baby's feeding patterns or behavior?
He's been fussier than usual and sometimes pulls away from the breast during feeding. I thought he might be colicky, but now I wonder if it's related to my condition.
It's possible. Babies can sometimes sense when something's not right. Are you experiencing any nipple discharge, especially any that appears unusual?
Not that I've noticed. The milk seems to flow just fine, but the pain makes it difficult to continue feeding for long.
Understood. Mastitis is an inflammation of the breast tissue, often due to an infection, and it's not uncommon in breastfeeding mothers. The symptoms you're describing seem to align with that. However, we'll need to run some tests to confirm.
I was worried it might be that. I've heard of mastitis, but never thought I'd experience it myself. What can be done about it?
Treatment usually involves antibiotics to clear the infection. It's also essential to keep breastfeeding or pumping to ensure the milk ducts don't get clogged, which can exacerbate the condition. Warm compresses can also help alleviate some of the pain and inflammation. We'll discuss a detailed treatment plan once we have the test results.
Thank you, doctor. I just want to get back to normal and ensure my baby is getting the best care.
Absolutely. And we'll do everything we can to ensure that. Let's start with a physical examination and then proceed from there.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, doctor.
Good afternoon. How can I assist you today?
Doctor, I've been experiencing frequent urination, increased thirst, and constant fatigue for the past few months. I'm worried it might be diabetes.
I understand your concerns. Have you noticed any unexplained weight loss or increased hunger?
Yes, doctor. I've lost about 10 pounds in the last 2 months without trying, and I'm always hungry.
All right. Do you have a family history of diabetes?
Yes, my father has type 2 diabetes.
Noted. Are you currently on any medications, or have you been diagnosed with any other conditions?
No, doctor, I'm not on any medications, and I haven't been diagnosed with any other conditions.
Do you engage in regular exercise or have any specific dietary habits?
I walk occasionally, but not regularly. My diet is a mix of everything, but I do have a sweet tooth.
How about alcohol or smoking? Do you consume any?
I drink occasionally, but I don't smoke.
Thank you for the information. Based on your physical examination, I note that you are overweight with a BMI of 28. Your blood pressure is 190 mmHg. Pulse rate is 78 BPM, and your saturation is 98% on room air. Upon inspection, I see no signs of skin infections, but there is some darkening around your neck and armpits, which can be a sign of insulin resistance. Your feet show no ulcers or cuts, but there is some loss of sensation. I've reviewed your blood tests, and your fasting blood sugar is 140 ml, and the HbA1c is 75%, which is above the normal range.
What does that mean, doctor?
These results suggest that you have type 2 diabetes. The darkening of the skin, called acanthosis nigricans, and the numbness in your feet indicate that you might have had elevated blood sugar levels for a while. The HbA1c test gives us an average of your blood sugar levels over the past 3 months, and a result of 7.5% confirms the diagnosis.
Oh, I see. What should I do next?
First, don't worry. Diabetes is a manageable condition. We'll start with some lifestyle modifications, including a balanced diet and regular exercise. I'll also prescribe some medications to help control your blood sugar levels. Regular monitoring and follow-up appointments are crucial. We have a dedicated diabetes care team that will guide you through the process and provide all the necessary support.
Thank you, doctor. I appreciate your guidance and support.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Doctor, it seems like my son Luke is always catching a cold. It's been 4 times in the last 3 months. I'm very concerned about his immunity.
I understand your concerns, Mrs. Johnson. Children, especially those in daycare or school, can catch colds frequently due to exposure to various viruses. However, let's review his medical history. Besides the colds, is he on any medication currently?
No, just the multivitamins I give him, and occasionally some over-the-counter cough syrup when he has a bad cough.
All right. It's not unusual for kids his age to have multiple colds a year. Their immune systems are still developing. However, it's essential to ensure he's getting a balanced diet, adequate sleep, and regular exercise. These factors contribute to overall health and immunity.
I do try to ensure he eats well and sleeps on time, but with the colds, his sleep sometimes gets disturbed.
It's a cycle sometimes. The cold affects sleep, and inadequate sleep can make one more susceptible to illnesses. But let's monitor him for a few more months. If the frequency doesn't decrease, we might consider some tests to check his immune function. For now, continue with the multivitamins and ensure he washes his hands frequently.
Now look at question 26.
Hello, I'm Dr. Carter, the surgical resident on call. I wanted to discuss Mr. Collins, who underwent a gallbladder removal yesterday. He's complaining of severe abdominal pain and has a fever.
Thank you for bringing this to my attention, Dr. Carter. Post-operative infections are rare but can happen. Have you ordered any imaging or blood tests?
Yes, I've requested an abdominal ultrasound to check for any fluid collection or abscess. His white blood cell count is elevated, indicating a possible infection.
Good call. We should also start him on broad-spectrum antibiotics while we await the results. It's crucial to address any complications promptly to ensure the best outcomes for our patients.
Absolutely. I'll ensure he's started on the antibiotics immediately and will monitor his vitals closely. Would you like to review him with me once the ultrasound results are in?
Yes, please keep me updated. Early intervention is key, and it's a learning opportunity for both of us. Thank you for being vigilant.
Now look at question 27.
So Jenna, can you walk me through where you'd store the new shipment of antibiotics?
Certainly. I would first check the recommended storage temperature on the label. Most antibiotics should be stored at room temperature, away from direct sunlight and moisture. But some might require refrigeration.
Exactly. And why is it so vital to store them at the right temperature?
Improper storage can reduce the efficacy of the medication. For instance, if exposed to heat, some drugs might degrade and become less potent.
Right, and in worse cases, they might even become toxic. And what about vaccines?
Vaccines are very sensitive. They should be stored in a refrigerator, usually between 2 degrees to 8 degrees Celsius, to maintain their efficacy. And it's crucial to avoid freezing them, as it can damage the vaccine.
Good job. Always remember, patient safety is our top priority, and proper storage plays a crucial role in that.
Now look at question 28.
Emma, I noticed you recommended a high-fiber diet for Mr. Martinez. Can you explain your reasoning?
Yes, Dr. Mason. Mr. Martinez has been complaining of chronic constipation, and after reviewing his dietary records, I observed he has a low intake of dietary fiber.
That's a good observation. But remember, when introducing fiber into a diet, especially for older patients, it should be gradual. Why do you think that is?
Introducing fiber suddenly can cause bloating, gas, and even more discomfort. Gradually increasing fiber allows the digestive system to adjust.
Correct. And we should also remind Mr. Martinez to drink plenty of water, right?
Absolutely. Fiber works best when it absorbs water, making the stool soft and bulky. Without adequate hydration, a high-fiber diet could exacerbate constipation.
Well done, Emma. Proper guidance and gradual changes can make all the difference in patient comfort and health.
Now look at question 29.
I've been seeing Mr. Thompson for a few sessions now, and he seems to be struggling with severe anxiety, especially in social situations.
Has he mentioned any specific triggers or events that exacerbate his symptoms?
He said crowded places and unexpected social interactions make him feel overwhelmed. He also mentioned his job requires him to attend frequent meetings, which has been a source of stress.
It's challenging when everyday situations become sources of distress. Have you considered introducing him to cognitive behavioral therapy techniques?
Yes, I've started him on some breathing exercises and grounding techniques. I also think he might benefit from exposure therapy, but I want to take things slow to ensure he's comfortable.
That's a good approach. Consistent support and gradual exposure might help him build resilience over time. And always remember to check in about his comfort level.
Absolutely. Patient well-being is always the priority. Thanks for the advice.
Now look at question 30.
Hand hygiene is a foundational practice in any healthcare setting. It's not just about keeping our hands clean, but also about preventing the spread of infections. In a hospital where patients are already vulnerable, this is paramount.
Absolutely. And it's surprising how many healthcare professionals sometimes overlook this basic step, especially when they're rushing between patients.
That's why it's crucial to instill the habit early on in training. Hand hygiene isn't just about using soap and water. The technique matters. It's about covering all areas of the hands and wrists and ensuring they're dried properly. And when soap and water aren't available, using an alcohol-based hand sanitizer is equally effective.
And it's not just after patient contact. It's before and after any procedure, after touching any potentially contaminated surface, and even after removing gloves.
Exactly. The World Health Organization has a 5 moments for hand hygiene, which is a great guide to when and why hand hygiene should be practiced. Educating both staff and patients about its importance can make a significant difference in patient outcomes.
Couldn't agree more. Prevention is always better than cure, and this is one of the simplest ways to prevent a host of complications.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we're joined by Dr. Alex Thompson, an expert in neurology who recently led a comprehensive research study on epilepsy in Nepal. Dr. Thompson, can you tell us about the significance of this study and what drove you to choose Nepal as your research focus?
Well, the decision to focus on Nepal was driven by a glaring gap in our understanding of epilepsy prevalence and management in South Asian countries. While epilepsy is a universal condition, the challenges faced by patients in countries like Nepal differ greatly from those in Western nations. I felt it was vital to understand the unique landscape there, and to be honest, I was curious about how traditional beliefs might influence the perceptions and treatment of epilepsy.
Fascinating. Were there significant differences in how epilepsy is perceived in Nepal compared to Western countries?
Absolutely. In many Western countries, epilepsy is viewed primarily as a medical condition, with a push towards understanding its neurological basis. However, in Nepal, there's a strong intertwining of cultural, spiritual, and medical beliefs. Some communities view seizures as a result of past sins or as a spiritual possession. This has a significant impact on how patients seek and receive treatment. For many, turning to traditional healers or shamans is the first step before considering modern medical interventions.
How did these cultural beliefs influence the management and treatment of epilepsy in Nepal?
Well, due to these prevailing beliefs, there's often a delay in seeking medical treatment. By the time patients reach a healthcare facility, they might have had seizures for several years without appropriate management. This delay can exacerbate the condition and result in a poorer prognosis. Additionally, there's a notable shortage of anti-epileptic drugs, AEDs, and trained neurologists in the country. The healthcare infrastructure struggles to meet the demands of the population.
Were there any particular cases or stories from your research that stood out?
One that comes to mind is about a young boy named Raj. He began experiencing seizures at a very young age. but his parents, attributing the condition to a curse, sought out spiritual remedies. By the time they reached a hospital, Raj's condition had deteriorated significantly. Fortunately, with the right treatment and interventions, he started showing improvement. Raj's story emphasizes the urgent need for increased awareness, early diagnosis, and appropriate management of epilepsy.
It must have been quite an eye-opener. What were some of the key challenges you faced during this research?
Well, gaining the trust of the local communities was a hurdle. Many were initially wary of outsiders probing into their personal health and beliefs. Additionally, the rugged terrains and remote locations made data collection challenging. But the dedication of our local liaisons and the warmth of the Nepalese people made our task achievable.
For anyone looking to further research or work in the field of epilepsy in such unique settings, what advice would you offer?
First, it's imperative to approach the topic with cultural sensitivity. Understanding and respecting local beliefs is crucial. While medical expertise is essential, one must also possess excellent interpersonal skills and be adaptable. Each region, each community has its own set of challenges, and being flexible and open-minded can make a world of difference in effective research and treatment.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome to our discussion today. We have the pleasure of hosting Dr. Emily Thompson, a renowned ophthalmologist from the University of Florida. Dr. Thompson is here to share insights from her recent studies on the progression and management of glaucoma, a leading cause of blindness. Dr. Thompson, thank you for being here today. What are the major findings from your recent studies?
First off, thank you for having me. Glaucoma is often called the silent thief of sight because of its subtle progression. From our studies, we've ascertained that early detection remains the cornerstone in preventing vision loss. What's alarming is that a significant portion of the population remains undiagnosed until the disease has significantly advanced. Modern imaging techniques have made it easier for us to identify and monitor glaucomatous changes, but we still face challenges in increasing public awareness.
Can you elaborate on these imaging techniques and how they've changed the diagnosis process?
Certainly. Traditionally, glaucoma diagnosis relied on intraocular pressure measurements, visual field tests, and optic disc assessment. Now, we have advanced tools like optical coherence tomography, OCT, that give a detailed cross-sectional image of the retina. This helps in detecting subtle nerve fiber layer changes, often before the patient notices any symptoms. Additionally, technologies such as the Visual Field 24-2 and 10-2 tests allow for a more precise understanding of the patient's functional vision and progression rate.
For our listeners who might not know, can you briefly explain what glaucoma is and its types?
Absolutely. Glaucoma is a group of eye diseases characterized by damage to the optic nerve, usually due to increased pressure in the eye. The two primary types are open-angle and angle-closure glaucoma. Open-angle is more common and progresses slowly. Angle-closure glaucoma can appear suddenly and is more intense. Both can eventually lead to vision loss if not treated.
How has the treatment approach evolved over the years?
Earlier, the primary approach was lowering the intraocular pressure with medications, laser treatments, or surgery. Now, while these still remain vital, there's a more holistic approach to patient care. We focus on lifestyle changes, monitoring sleep apnea, and even considering yoga postures, as some positions can elevate eye pressure. Newer medications with fewer side effects and better pressure-lowering effects are being developed, and minimally invasive glaucoma surgeries have risen in popularity, offering safer alternatives with faster recovery.
What's the feedback you get from patients regarding these treatments?
Many patients appreciate the non-invasive nature of recent advancements. They're particularly fond of the newer medications with fewer systemic side effects. But like any treatment, adherence remains an issue. Some patients find it challenging to keep up with eye drops or follow-ups, emphasizing the need for more patient education and simpler treatment regimens.
Lastly, are there any misconceptions about glaucoma you'd like to address?
One major misconception is that glaucoma only affects the elderly. While age is a risk factor, even younger individuals can get glaucoma. Another misconception is that it's only about high eye pressure. While pressure is a significant risk factor, there are patients with normal eye pressure who can develop glaucoma. It's essential to have regular eye checkups, understand the risks, and take proactive steps towards prevention.
Dr. Thompson, thank you for this insightful discussion and for shedding light on such a crucial topic.
My pleasure. Thank you for having me. It's essential to keep these conversations going, to increase awareness and ultimately prevent avoidable blindness.